I was diagnosed at the age of 19 in 2009. They thought it was a cyst in my arm.
I found a lump in my left breast, and truthfully, my nipple inverted. That's what happened.
They did a biopsy, and then it came back that it was lymphoma, and things started rolling very quickly.
I called my doctor, my GP that day, and basically said, you know, I need to get in, which I did the same day. The time between my mammogram and my ultrasound was probably the longest length of time. It was probably 4 to 6 weeks.
I had a bone marrow biopsy, and then chemotherapy started right away, and after that I had radiation.
I pretty much knew, and I had a very frank conversation with the radiologist that, listen, I'm busy, I have a busy career, I've got a busy life, I have a little boy, I'm not a child, I'm 40 years old, I need to know what's the deal. It's a tumor of some sort, we don't know if it's malignant or not, but that's why we're doing this biopsy.
So yeah, I did chemotherapy for a few months, and it was rough. I had to come out of the science degree, my science degree at Breton University, and kind of felt like I was just losing everything in my life at the time. But then I came here, and the staff are phenomenal, and they made the biggest difference in my life.
So my husband knew, obviously, but other than that, we just kept it to ourselves. 1 week after the biopsy, a year ago today. So I got the call from my GP asking us to come in, which we did. The rest is history.
After I graduated, I had no idea what I was going to do. I went into the science program at CBU, and I just wasn't sure. And then when I was sick, I came here. The nurses were phenomenal. They went above and beyond, just did everything that they could for me whenever they could, and they were phenomenal. So I considered whether I could pursue a career in nursing, and so after I finished treatment, I applied to CBU, and I was accepted, and here I am.
As he calls the cancer center to speak to the oncologist, Ron McCormick, I have a 40-year-old woman here. She just turned 40. She has an aggressive breast cancer, and I need you to see her ASAP. And I was sitting across from him thinking, oh my God, who is this person that he's talking about? That poor, poor soul. Oh my God, that's me. So that was probably, in all of the appointments, the moment when I thought, this is the big one, the big C, which I called it for weeks before I could actually say the word.
It just did not seem real. When I received the job offer, I could not believe it. Where I spent days of my life receiving my treatment with these people, and now I was going to work with them and be a part of their team. It was just, I can't even describe the feeling. I was ecstatic.
When I met with Dr. McCormick, that what was going to be the consultation started out as a conversation and ended within 30 minutes of me being in emergency chemotherapy. So I didn't have time to prepare for chemo. As far as my family knew, I was going in to meet with the oncologist for the first time. You know, an hour later, we called my parents and said, we're headed to chemo. So I had my first chemo. 2.5 weeks later, my hair started to, you know, fall out in the drain and on the pillow, and I called my girlfriends and said, today's the day. So we went for lunch. I consoled them because they thought they were stressed for me, and I was okay. I was totally fine. We went to the hairdresser, we took pictures, we laughed. It took Garrett probably a couple of days to warm up to the whole idea because, again, it's the visual now. So I did make an effort to keep my head covered for a couple of days, but you know, you're running around and you're getting ready for work in the morning, and So I get out of the shower one morning and I was all dressed for work, but I had forgotten to put my wig on because it wasn't part of my normal routine. And then when I realized my head wasn't covered, I went to cover my head and Garrett said, "It's okay, Mom, I'm okay with it now." And then that was it. I didn't have to worry about covering my head anymore. So that was a big deal.
I can understand their hardships every day. I can be there to support them, and I don't know that there's many nurses that can truly understand what the patients are going through, and I can. Whether it's losing your hair, losing your job, losing your studies, just losing your health in general. I understand what the patients are going through, and I can be there for them because I went through it.
Here I am being brought into a room I've never been in before. You know, I've never even been in the cancer center. It was my first day in the cancer center. And I walk into the chemo room for the first time, and the nurses there are, I mean, they were so good to me there. And they treat children, men, women.
I'm just gonna get it.
Okay. From the time I walk in the door at reception, to the nursing staff, my doctors, you know, I can't.
Here you go. Welcome.
I can't say enough about them.